Start with fractionated 1064. Have a good look. It's pretty clean from that end. Generally, I keep that one nice and closed anyway. I don't think this one twists off, so just get one of these. Never go around in circles. Always just dab very gently. Any specks you can see. Just very gentle dabbing. Right, couple flecks there, and then I'll clean the inside of the barrel in circular motions, not touching the lens itself. Okay, and I'll get a gentle fibrella. Okay, we don't need it to be this big. So what I'll do is I'll just halve the fibrella, take a strip, give it a fold, press that one in there like that and make some silicone. Okay, and take my fractionated handpiece and give it a nice clean. Right, very gently, just getting any debris off the lens, off the inside of the cartridge. Okay, now that that's done, I'll take an alcohol wipe. These ones are 75% alcohol. Okay, this will never touch the lens itself. Alright, we just give the whole handpiece a nice sanitize into all the little cracks. Think about where bacteria likes to live. Give it a nice clean. Keep that capper clean. So when you think about when you're touching a handpiece, that is the first thing you touch. Okay, so the cap gets special attention. That's beautiful and dry. So we'll put this one down and let it dry. Brand new alcohol wipe each time, brand new fibrella. Okay, and brand new one of these. My Zoom collimator, the one that I use for carbon facials. So if you think about it, this one gets dirtiest. The most amount of plume arises from my carbon facials. You'll be able to see here, when I twist it off, there is a fair bit of debris and carbon buildup inside the case. But otherwise, the lens is clear because I clean it before and after each procedure, but I'll also take special attention to have a look at them and inspect them when I've got some downtime. Okay, go through, make sure that the mechanism is working correctly. Pull it down. Oh, it's hard to do it when you're facing away. It's moving beautifully. So when you pull this down and you twist it, you'll notice the lens gets further away or closer. Okay, and that is the spot size. So, same again, the lens is further away, so just very gently. Keep that on an 8. Poke off any debris so that we don't scratch the lens. Not sure if you can see any of that. Just give it a quick 1, 2. Now it's so important that you clean your lenses thoroughly and you inspect them before each of your clients, because any debris on the lens can deviate the laser beam, and it can be very dangerous. It can cause blindness. It can wreck the lens itself. It can burn a mark into the lens where the debris was. Okay, so it sort of cakes on like an oven burn. Not with my lasers. Alright, so now that I've done a very gentle swabbing, I'll get some more Vibrella, fold it over, make a dome, okay, and then give it a very gentle clean. We are not touching the lens here, not going in circular motions, only cleaning out the inner canal. Maintenance is the most important part of owning a laser. Everybody is affected by it. Okay, now that that is clean, we pop that one down, alright, and clean the tip itself with a fresh alcohol wipe. This is a collimator, so this tip will never typically touch your client's skin. It usually goes above their skin at whatever range is set in your parameter guide. But I still like to give this one a thorough clean, only because it could touch their skin. Alright. And like I said before, there is a lot of plume associated with the carbon facials, and that carbon likes to splatter everywhere. Gets into all the little finer parts of your hand pieces. So have a look at that now. Oh, it's nice and clean. Try not to drop it. Beautiful. Alright, now we do the outside of the handpiece itself. Killing bacteria, removing debris. It's nice just to have clean equipment to begin with anyway. Putting that down. Making sure your electrical connections are nice and clear of debris as well. Okay. Now you can see here, this one is actually a little bit loose for my liking. You can hear that. I might actually give my provider a call and see if we can just get that one tightened up a little bit, because that's not good. When it comes to lasers, you want everything to be taut. Okay, again, paying a lot of attention to the cap. It's usually the first thing that we touch when we grab the hand pieces out of the case. Alright, we'll let that one dry. Now, I use this one the most. This is my zoom handpiece. I use this for laser tattoo removal, the most anyway. And this one goes directly on the client's skin. Okay, so parameter guide suggests it's skin to skin contact. And so this part here will always be flush with the skin, be parallel to the skin. And as the name suggests, it's a zoom handpiece. So there is a magnification that goes on the inside of this. Have a look. Always beautiful and clean. And it's a lot closer. If you see, I would be able to touch the lens with my finger here, but obviously we're never ever going to do that. I'm going to take a nice brand new Q-tip, dab off any debris, right, and very gently, very gently clean the inside. Right, making sure I'm not touching that lens. Taking fibrilla. Give it a good wipe. Okay, now that the inside is clean, have a look at the outside, get a new alcohol wipe, and give it a nice clean. This one's nice and tight, we don't have any wiggle in the handpiece or electrical connection. So that one's all good. Alright, shiny and beautiful, pay extra attention to the cap. We'll leave that one to dry. Now we cannot forget which tips go on which. So that one goes on this one, that one goes on that one. Okay, now this is my 785 collimator. This one is really good for toning, skin toning, and you can see here that it comes apart in the middle as well, so that you can get more access to the lenses itself. So these two lenses are separatable. Now I don't like to take these ones apart too much, but it does look like there's a little bit of debris on the inside of the canal, so we'll put this one back together very carefully. Metal on metal. Have a look at that. We do have some debris on the inside of the canal. Really don't know if you guys can see that at all, but I'm gonna take off this tip. Oh, it's not budging. Don't get right down there. Trust my fingers. See if I can release some of these from the lens. And clean this beautiful handpiece. Okay, I'm going to fibrilla down there. I'll just use my finger because the canal's so long. Alright, so you can see nice and clean now, no dust, no particles, good to go. Fresh. This is also my Pico handpiece. So we are no longer in the nanosecond range, we're in the picosecond range, a trillionth of a second entering the skin. This is a short pulse laser, so unlike a hair removal device, it enters the skin at a trillionth of a second instead of in a second range for hair removal, or a nanosecond range, which is a billionth of a second. Beautiful. Pay special attention to the cap. Make sure that the electrical connection is clear, free of debris, and beautiful. And that's my 785 collimator handpiece. Okay. Now I've got my fractionated Pico handpiece, dia fractionated 785S. Okay. Very good. It comes with 3 different settings, 1, 2, and 3, based on intensity. Okay, we're going to take that back to 1. Alright. The tip comes off with this one nicely. It's so important not to over torque these because they can get stuck. Metal on metal does not like that. Let me get some more. Now the Q-tips I use are pointed. I use that to get that debris off the lens by poking it very gently and lifting it off the lens. You can see here, there's only one little piece of debris that I can see. Otherwise, it's a beautiful handpiece. This one gets used a whole lot less than the other ones, but the fractionated function is just so incredible, and every laser technician should be using a fractionated handpiece if they're doing laser toning, correcting, pigmentation correction, all of that kind of stuff. Now we've got our alcohol wipe and we're going over it, focusing on that cap as well. Never ever touching the lens itself with the alcohol wipe because it can break down if there is a film on it. It's just an absolute no-no. Grab this one too. Alright, beautiful, absolutely no debris, no bacteria, and it looks amazing. So, clean, clear, and under control. Alright. Twist that back on. Metal on metal. Perfectly cut to fit together perfectly. And that's my Dyer fractionated 785 handpiece, Pico second range. Okay. And this is my 785 zoom.